Mohammed, you are bringing us home, my friend. Okay, so you got the 5 minutes, not 8 or 9, 5 minutes to do the demo. Okay, and then we'll just bring the questions in at the end. Thanks for bringing us live from. I guess you're in Portugal still, right? You're in Lisbon, from the car.
Yes, I'm in Lisbon.
Thanks, buddy.
Actually, I faced with an unexpected travel, so I should travel for a while, and it became coincident with the event. So my friend is driving, and I am pitching.
That's good. We haven't had one of these for a while. This is great. No crashing though. Okay. All right. Go for it.
Okay. Let me share my screen. Okay. I'd never be a fan of Zoom. Okay, that's it. Can you see?
Yes, we can. Yeah. Yeah, perfect.
Okay. Hello, everyone. I am Mohammed, CEO and founder of SensoMatt. Imagine that you are one of your beloved person should use wheelchair as the only means for their movement. In addition with their disability that they are suffering with because of their physical restrictions, they are in a risk of getting one of the worst hard to heal wounds ever. We call it pressure ulcer, or people call it bed sore. Bed sore appears when a living tissue being pressed between an external surface and internal bones. It is very bad, very, very painful, and very, very expensive to be treated. In SensoMatt, our strategic mission is to fight against pressure injury by applying high technology and artificial intelligence-based solution for prevention, prediction, and also treatment of the pressure injury. The current solution that I'm going to pitch for this purpose for the wheelchair users is a very simple solution. We are implementing our patented sensors inside a cushion, a typical wheelchair cushion, and we measure the movement. And based on our developed neural network, we could extract the user's personal trend of the movement during their daily activities. By means of a mobile application, we send alarms and notification. If the wheelchair user movement would be below a healthy trend, they will be warned to make it more, and they will receive suggestions how to make it more. Besides that, there is a gamification. They will receive rewards. They will receive notifications to make more movement and to be motivated and to encourage them to have more movement. There are lots of competitors in the market, but most of them are focusing on making some direct action by changing the temperature of the cushion skin, by making some motion to the cushion skin, by making some wavy motion to avoid getting pressure injury. But the problem is that they are all good, but they are passive and they do not get feedback from the users. What we're focusing more is a different solution to focus on the lifestyle, on changing the lifestyle of the wheelchair user. We believe that this will be the solution to avoid getting pressure injury. If you make more movement, you get less pressure injury. This is our roadmap. Right now, we are fundraising. We are now piloting our first version of our product, and during next 4 to 5 months, we will start selling. During the next year or the year after, we will also have the next round of fundraising. What we're looking for, we are looking for 500K in return of equity. We are also open to negotiate on loyalty fee for the investors who have network of sellers or have access to a good marketplace for us. How the money will return, besides selling the product, we are also working on the other pipelines, such as cross-selling and upselling of similar but different products besides that. We are focusing on business to customer as the main revenue model, but besides the B2C, we have intention to sell our product in terms of CKD and SKD to other wheelchair manufacturer or cushion manufacturer, and we are also working on selling freemium subscription and also selling the subscription of our API to some other manufacturers. What we are going to do with this 500K is like this. We are continuing an R&D activity to make everything much better, and we will start selling activity, advertising, start selling campaigns, giving promotion, and make some networking to to have better sales. The target market for the wheelchair users is pretty big. More than 130 million wheelchair users are living in the world. But we are thinking above. We are thinking about a big cushion market for ordinary normal people in their offices, in their homes, in the universities and schools. The team of the founders and the experts in SensoMatt would be seen here. Almost all the founders are immigrants from Iran. We came between 6 to 4 years ago, and we have started our venture in Portugal. We are also working with several local talent advisors, such as people from Startup Portugal and people from universities, a university professor, and so on. Thank you very much. I hope that I could do it in 5 minutes.
Mate, that's really good. 4:45. I love it. Thank you so much for that. At the end of the session, that's really, really kind of you. Okay, so over to Helga for the honor of the question on this, and then Ori, bring us home, okay? And then we'll do a little reflection as a whole group.
Yeah, sorry, I've just realized that I had my chat pointing to just a direct message to someone, to Ori, and I just wanted to congratulate properly Vix and Sarah for such an amazing job they did with the pitch. I really enjoy that. My question is, I saw that slide very quickly, where you had product development happening now and then sales happening a lot later. I just wanted some clarity on that, and really just to understand what the thought process is in terms of the timing of the selling. Why is selling being done later? I wanted to understand that. Please.
Okay, thank you very much. Honestly, we are now working on the selling aspects, but because this product is considered to be a kind of medical product, we need to have some validation for the medical regulatory body, and we are working to start selling sooner, but not with a medical product, with a different cushion that we introduce for health and well-being. If we are not focusing on the pressure injury and pressure injury prediction, we could sell a cushion for the daily usage and lifestyle improvement of the wheelchair users. And this is not medical. This is what now we are working, because we have a working product, and it would be better for all of us to start selling as soon as possible. But the barrier is the regulatory medical CE mark that we have applied, and we need to fulfill and complete several tests before using the label of the medical CE mark for our product. But yeah, we have right now that we are talking together, we have signed an agreement with an advertising company to start advertising, to launch a local selling campaign inside the Portugal for us. The duration of 4 to 5 months before selling is the worst case scenario. If everything goes bad, we will start selling in 4 to 5 months. But right now we are working on it to have sell as soon as possible.
But so you need the medical certification so you can sell B2C, correct?
Yes.
And have you got proven sale, or have you gathered interest or feedback or reviews from your proof of concept trials? Have you worked with people, human beings who have used this, and have you gathered that type of?
Yes, of course, because our product is connected to an artificial intelligence engine. We had several tests, but most of them were performed by healthy people, not the people on wheelchairs. So they are real people. They sit on a cushion, but this is not real environment. So we have lots of information, but not considered to be clinical information. We could apply for a normal CE mark, but not for a medical CE mark. For medical CE mark, this product considered to be the class 1 of danger in medical CE mark, if we want to apply as a medical device. But for class 1 products, we also need declaration of conformity. So we should perform several tests before entering the market. We have a working prototype, but we are working on the tests that we need to complete before entering the market. To start selling as a non-medical product, we are also talking with several consultants about this. If we could start selling as a non-medical product, as a product for well-being and healthcare, this is also a solution for us. If we could do this, we'll start in very sooner, in 1 month or less.
And so your plan is to obviously beta test this product with people who actually suffer the condition that you are aiming to prevent or to improve,
Yes.
right? I mean, I would imagine Tiana is all over this question.
Yes,
Thank
exactly.
you, Mohammed. Congratulations.
Thank you very much.
Thanks, Helga. All right, Ori, bring us home. I can see Rachel wants to ask Mohammed 1,000 questions, but I'm just going to go to Ori to bring us home. Okay.
Do you know what? I also have 1,000 questions, but you'll kill me if I ask them all. So I'm going to ask the one question that's been bugging me, because I love the presentation and the concept, and it's very detailed, and please forgive me if I'm being like very narrow-minded and I've not understood the concept, but how does the patient move? Like, they get a notification to say that they have to move, but they're wheelchair bound. I'm sorry, could you please explain to me what that looks like?
Wheelchair users are divided into 2 different groups. Between 60 to 65% of the wheelchair users are able to make movement by using their own wheelchair handles. They could lift their body for a few seconds, or they could lift the wheelchair to a chair or a bed, or for the car seat when they are using the car. The others, we are talking about this portion of the wheelchair user society. We are designing a new mobile app for those people who has serious mobility problems and using wheelchair. We send notification alarms to the caregivers and nurses or relatives who are living with them and ask them to make movements. But for the others, based on several interviews that we had before with the wheelchair users, they are open and they are capable to make movements even when they have mobility of their hands, when they have control in their hands. They could move their lower bodies using the wheelchair handles. That would be enough to avoid getting pressure injury. For example, you are using your wheelchair for several hours. We send a notification. Okay, your movement is below your trend. Just lift your body for 5 seconds, 4 seconds, and it will reopen the veins to restart the blood circulation in that specific area which is under pressure.
I think like Apple Watches already do that. Like, I understand that it's a different
Apple
device,
Watch, Apple Watch and other products are using internal accelerometer or gyroscope to find out if you have enough movement. But they do not measuring everything. They do not measuring everything because some of the movements, for example, your head, your shoulders, the other hand could not be measured easily. What we are doing is to measuring precisely the center of gravity of the body. When you move your hand or you move your head, the center of gravity of your body will be changed by centimeters or millimeters. We measure this and we consider it inside the movement profile that we are producing, we are generating for each user.
Hi, gotcha. I think my one feedback is that it would probably really help to spend a bit more time on the actual user experience during the deck, because I was actually so worried about how would the person move that I kind of really couldn't focus on the rest of the info. I appreciate I'm not the primary audience that you would be putting this together for, but that'll be my bit of feedback. But thank you. It was a great product.
Exactly.
Thank you, Ori.
This is the main purpose of our activities in these days. We are looking for wheelchair users and try to test it in real condition.